Let us formally begin the session. So today's session is kind of a parallel session that we are organizing again with the support of the US Consulate Kolkata. I'm audible, right?
Yes, you are.
But today's session is a bit different than what we have been doing for last few months. So today we are going to be focusing totally on health journalism and beyond. So we are going to see how there has been a surge of disinformation and misinformation in the recent past, and what can be the counter strategy in order to debunk such information asymmetry or false information. So just to share a very brief about today's session, we all know that digital media and citizen journalism have escalated the infiltration of fake news in the recent past. Especially the Covid-19 pandemic has seen a surge of misinformation leading to anti-mask and anti-vaccine protests on a global scale. So countering false information, of course, needs to happen at all levels. First of all, by the journalists who are at the front line, but also by us who play a crucial role in circulation of unverified messages, be it related to the pandemic, be it some other things, some other important stuffs. So it is needless to say that the counter strategies should be focusing on the presentation of authentic and accurate information before the audience. Another thing we need to understand is misinformation is not always disinformation. When we are talking about false information that revolves around pandemic or vaccination, it is not always shared with an intention to misguide people or to hurt somebody, because much of the information, much of the false information shared online is often circulated further by common people like us, who are just probably trying to figure out that what they're supposed to do amidst the ever-changing guidelines and regulations related to the pandemic, the vaccination, and of course the unprecedented situation that all of us are in right now. In addition, surges in new information, be it misinformation or disinformation throughout the pandemic, tend to have been accompanied by resharing of same post multiple times, leading to vast circulation of advice and data, both official and unofficial, without knowing the genuineness of the same piece of information. And these have been flooding the internet. So it's a problem that not only increases and doesn't reduce unless and until we intervene from our end. And this can certainly undermine the public health efforts to control the pandemic. So this is about the background, why we thought of organizing such a session with a close group of mid-career journalists who have been at the front line, who have been countering the surge of the tsunami of infodemic, I would say, during pandemic. So we are glad to have with us Ms. Monidika Banerjee as our resource person with us today. And following her deliberation, it is going to be an interactive session with the participants. So I would, of course, request all of you to come forward and share your experience, what kind of challenges you have faced related to pandemic, false information related to the pandemic or vaccination, and how you decided to deal with it, or what do you think is required, what kind of training or what kind of tools and techniques that you think you would require to fight it better. So before we proceed to the session, let me introduce formally our key resource person, Ms. Monidika Banerjee. Ms. Monidika Banerjee is an independent journalist who, in her career reporting for newspapers and television from Kolkata over the last 40 years, became a familiar face and name across the country. She began her career with the Telegraph newspaper and spent the last 28 years as a journalist with NDTV, covering ordinary and extraordinary in Bengal, from the Maoist of Lalgarh to Mother Teresa's sainthood in the Vatican. Over the last 2 years, she has reported extensively on the COVID-19 pandemic in the eastern part of country. A student of Lady Brabourne College, she holds a diploma in TV journalism from Thomson Foundation in the UK, and she was a Hubert H. Humphrey Fellow in the US between 2001 and 2002. So without any further ado, I would request Ms. Monidika Banerjee to kindly take over. The floor is all yours, ma'am. Thank you.
Thank you so much. It's a pleasure being here and to discuss this crazy subject that I've been trying to research over the last few days. And it's so vast that I feel I have come to you almost underprepared, certainly. There's so much going on in this space of fake news that, you know, it's got to be a sort of subject of constant study. And I think all of us need to do it, all of us who are conscious, and all of us, of course, who are journalists anywhere in the world, not just here in India. I'm very happy to see that I have a colleague from Bangladesh across the border. She's also here. I'm very happy to speak to her as the session unveils. Let me just start with this. I mean, it's something I went and looked for, and there it was in my own house. Do you know what this is? This is arsenic alb 30. How many of you had it to prevent COVID-19 in the last 2 years? Will anybody confess that they did? Well, I did. This was one of the things that emerged as a sure shot cure for COVID-19. And this bottle is still lying with me, unused mostly, but there you have it. I remember it was called arsenic alb 30 liquid. So homeopathic medicines, part of the whole fake news gamut. And then there is this humble nimbu, lebu. That is another thing that we were all supposed to drink with warm water every day to ensure that the virus didn't catch us. Besides that, there was pepe pata, which is the leaf of a papaya tree, garlic, and God knows what else. Even you and I, journalists, educated, informed, privileged, fell for fake news like this that spread like wildfire when the pandemic started 2 years ago. Why then do we blame the vulnerable, the unread, the susceptible who swallowed loads of rubbish, hook, line, and sinker, and sometimes even cow urine? Shucharita, you may want to play video 1, which is a sort of comical look at this whole business of cow urine or gomutra being the cure for COVID. Shucharita, can you play that?
Yeah, sure. Just a second.
ये गौमूत्र है सर।
गौमूत्र के सेवन से कोरोना का वायरस हमारे अंदर नहीं जा सकता।
कोरोना क्या, कैंसर जैसे बड़े घातक रोग गौमूत्र और पंचगव्य से दूर होते हैं। सरकार से भी मांग करते हैं कि एयरपोर्टों पे शराब की दुकानें हटा करके गौमूत्र रखिए, गोबर रखिए, जो भी बात विदेश से आता है सबको गौमूत्र पिलाना अनिवार्य करिए। ऐसा लगता है कि गौमूत्र से जो है वो ठीक हो जाएगा।
विश्वास भी बहुत बड़ी चीज है।
कोरोना वायरस से पूरी दुनिया के सभी लोग जो है बहुत ज्यादा डरे हुए हैं। साइंटिस्ट जो है इसकी वैक्सीन अभी तक बना नहीं पाए और उनका कहना है कि अभी वैक्सीन बनने में थोड़ा टाइम लगेगा, लेकिन ऑल इंडिया हिंदू महासभा ने इसका सोल्यूशन निकाल लिया। सोल्यूशन बहुत इजी है और वो इजी सोल्यूशन है गौमूत्र।
हमने कोरोना को खीर चढ़ाए और फिर हम लोगों ने गौ माता की पूजा करके गौमूत्र का सेवन किया और गोबर का लेपन की वो किया।
गौ माता की जय, गौ माता की जय, गौ माता की जय।
इस समय मैं हूँ ऑल इंडिया हिंदू महासभा ने जो ऑर्गेनाइज किया है एक पार्टी, जिस पार्टी का नाम है गौमूत्र पार्टी। मैं भी ये सुन के पहले मुझे लगा कि शायद कोई मजाक है, लेकिन जब मैं यहाँ पे आया तो सच्ची में यहाँ पे एक पार्टी देखने को मिली। ये जो पीछे मेरा एक पोस्टर है, इसमें बताया गया है कि कोरोना जो है वो एक राक्षस है, वो एक नेगेटिव एनर्जी है जो इस वजह से आई है क्योंकि चाइना और यूएस और बाकी नेशन जो है वो नॉन वेज फूड खाते हैं बहुत ही गलत तरीके से। ये यहाँ पे मुझे बताया यहाँ के भक्तों ने और स्वामी चक्रपाणी ने।
जीव हत्या के परिणाम स्वरूप आप देखिए सेब सेव अस कोरोना सेव अस और एक एनर्जी पैदा हुई और उसके बाद कोरोना पैदा हुआ।
तो सारा प्रकोप इसीलिए आया हुआ है कि जब जब इस तरह की हरकतें होती है, इस तरह की दिक्कतें आती है कि जीव हत्या को जिस लेवल से किया जाता कर रहे लोग, ये ऐसा नहीं होना चाहिए।
कोरोना को माफ करो, खीर चढ़ाओ, पूरी चढ़ाओ और उसे क्षमा मांगो हृदय से। जो हमने जीव हत्या किया उसके लिए क्षमा कर दो, हमें माफ कर दो।
तो यहाँ पे जो है वो सबको गौमूत्र पिलाया गया इस पार्टी में, और इस पार्टी में हर चीज का इंतजाम था। यहाँ पे खाना भी था, म्यूजिक भी था, और यहाँ पे हवन भी किया गया कोरोना को दूर भगाने के लिए।
हम लोगों ने पूरे विश्व की कामना के लिए यज्ञ किया, अनुष्ठान किया। हमने कोरोना को खीर चढ़ाए। जो गोमूत्र का सेवन करता है वो निरोग रहेगा। गोमूत्र लेपन का करिए। और सरकार से भी मांग करते हैं कि एयरपोर्टों पे शराब की दुकानें हटा करके गोमूत्र रखिए, गोबर रखिए। जो भी बात विदेश से आता है सबको गोमूत्र पिलाना अनिवार्य करिए और गोबर लगाइए।
शायद आपको ये कोई मजाक लगे, लेकिन ये एक्चुअली में यहाँ पे हुआ। यहाँ पे कुछ लोग जो थे उन्होंने बोला कि कोरोना कोई राक्षस है, और कुछ लोगों ने बोला कि कोरोना एक वायरस है जिसको खाली गौमूत्र ही दूर भगा सकता है।
गौमूत्र जो सारे बैक्टीरिया मार देता है।
हाँ,
लेकिन कोरोना तो वायरस है।
ये भी एक वायरस है, बैक्टीरिया पनपते हैं इससे भी।
अच्छा,
एक बैक्टीरिया बनते हैं तभी हमारे अंदर रोग पैदा होता है।
कोरोना नहीं, कोरोना उतार है। हाथ जोड़ना लोग सीख रहे हैं।
कोरोना से हमने लोगों के बीच में काफी डर देखा है, काफी पैनिक देखा है और काफी मिस इन्फॉर्मेशन भी देखा है। लेकिन मुझे नहीं पता था कि मिस इन्फॉर्मेशन इतना बड़ा हो जाएगा कि यहाँ पे गौमूत्र पार्टी का जो है आयोजन किया जाएगा।
कोरोना शांत हो,
कोरोना शांत हो,
कोरोना शांत हो।
कोरोना खत्म करना है इसी से।
देश के जवानों के लिए मेरा यही संदेश है कि देश के जवान, युवा, साथी, बुजुर्ग, नेता सब लोग गोमूत्र का सेवन करें, गोबर करें।
लेकिन इस चीज का ध्यान रखिए, ऐसा कोई भी साइंटिफिक एविडेंस नहीं है जो ये कहे कि गौमूत्र से जो है वो कोरोना वायरस दूर हो सकता है। तो इन चीजों पे विश्वास मत करना। इफ यू लाइक दिस वीडियो, डू नॉट फॉरगेट टू ड्रॉप इन अ लाइक एंड सब्सक्राइब टू इंडिया टाइम्स।
It was a kind of, a funny take on this whole drama about Gomutra that we saw being offered as a cure for COVID. It is, funny, you can laugh at it, but it is also completely dangerous, because who were those people that you saw, spreading the word about Gomutra? They were sadhus venerated by most people in India. Their word for many is the truth. So these sadhus belong to the Akhil Bharatiya Hindu Mahasabha. The gentleman who was doing most of the talking was Chhatrapani Maharaj. This whole organization has huge spheres of influence in large parts of the country. And what they did on 15th of March, I think, in 2020, just as this whole scare about COVID was setting in upon us, was they held Gomutra or cow urine parties in several parts of the country. The clips you saw were from a party held in Delhi. In Kolkata also, there was one organized by a leader of a political party who was later arrested. Not only did they drink Gomutra, I believe there was also some prasad distributed made of cow dung and so on. So people actually had that and had it on cameras, I believe. But was any action ever taken against them? A BJP leader who hosted the party in Kolkata, he was arrested briefly, I believe, because there was a civic volunteer, which is, the semi-police, who was hanging around that particular event in North Kolkata. And that person was induced to drink some cow urine. And after drinking that, he fell sick. And, there was so much confusion at that time and so much protest that ultimately that particular BJP leader, a minor BJP leader, was arrested. But others largely went scot-free, with sayings like this, at that tea party, if you could not understand the Hindi that was spoken, what the sadhus were saying is that COVID is not really a virus. It is a demon unleashed on meat-eating people who eat meat. They were the ones to blame for all this. And, they were, and therefore the COVID virus had been unleashed by superpowers to try and kill these meat-eating populations. And what was the result of that? Just as an aside, in the pandemic year, the first year, I'm told that people in India stopped eating chicken in such large numbers that the industry took a 2,000 crore hit. It suffered losses of 2,000 crore rupees. And at one place, I believe, a poultry farmer in one day or so culled chicken worth 5.8 crore. So the vicious impact of this kind of fake news, goes down the road. I mean, it just doesn't affect you and me who are misled, but it affects industries, it affects the economy, and so on. Now, the sadhus aren't alone to blame for this, that's for sure. Several elected representatives have also repeated this kind of fake news about cow urine, for instance, and not just anywhere, but even in the state assembly. This state assembly episode was in Assam, in Guwahati, where a lady MLA, she went and said in assembly that cow urine can cure COVID. The lady was Suman Haripriya. And this was in March 22, so early on, even as the pandemic was setting in, and later, 1 year later, in May 2021, we had a BJP MLA in Uttar Pradesh, one Surinder Singh, who, for the record, sat and in front of cameras and drank cow urine and said everyone should have it. And he also said that if everyone in his constituency had it, then his constituency would become hugely famous. He was so excited about it. The name of the constituency was Bairai. And by any chance, if you are thinking only members of a particular party were propagating these lies, think again. There was a young man called Gaurav Padhi, and we should remember all this because it was so shocking. He was a member of the Congress's digital team, apparently in Delhi, and he tweeted in June 2021 that in an RTI response, and this is his tweet I'm reading, please don't consider it fact. In an RTI response, the Modi government has admitted that Covaxin consists of newborn calf serum, which is a portion of clotted blood obtained from calves less than 20 days old. This after they have been slaughtered. In capitals, he wrote, "This is heinous. This information should have been made public before." As you can imagine, I mean, remember 1857, the first war of mutiny, the kind of bullets that were used and set off the revolution. That was a great thing, rumors about, cow fat and pork fat and so on. But this here, in the 21st century, was outrageous because all possible medical authorities went out and came out to explain that calf serum is used for cell cultures for many vaccines. The vaccine did not contain blood, that using calf serum to improve cell cultures is common practice across several vaccines and not only Covaxin. So that was the way, across political spectrum, even responsible so-called political leaders went on to propagate fake news, from which, honestly, for 2020 and 2021, there was virtually no escape. So the funny video that you saw, I mean, ultimately, it is not a laughing matter. What does it do to us? Fake news has disastrous consequences. What we saw unfolding in 2020 and 2021 as well was attacks on doctors, nurses, healthcare workers, COVID patients, their families. In some cases, it has even cost lives. And there were many reports that one did in NDTV on the issues that erupted, but this was among the most disturbing reports that I had to file. Many of you may remember this incident from July 2021, which is just about half a year ago. It's about a man who waited for hours outside an emergency ward in a hospital next to an ambulance, which was to take him to another hospital. He waited and nobody came forward to help him get into the ambulance. His wife tried and tried, she just failed. There was an ambulance driver standing in a PPE suit. He didn't lift a finger to help. Shucharita, if you would please play a video 2, which is the NDTV video I have listed over there. Shucharita?
Yeah, just a second.
Thanks.
Aparna Dotto's desperate cries for help fell on deaf ears. The man in the PPE simply walked off, and bystanders only offered advice. "40 minutes or so later, 68-year-old Madhub Narayan Dotto died. He was admitted to the state-run Bonga hospital with breathing trouble Saturday, referred to a Kolkata hospital at 8 p.m. An ambulance was arranged, but he never made it into the vehicle. His wife not strong enough to help him into it, he too weak to help himself. And all this happened right outside the hospital's emergency entrance."
হাসপাতালে গাফিলতিতেই আমার স্বামী চলে গেল, একদম একদম বিনা কারণে, বিনা ওই অক্সিজেনের অভাবেই আমার স্বামী চলে গেল, নাহলে আমার স্বামী যেত না।
Equally horrific reports from a village near Kolaghat, where Shanaton Pradhan, who tested positive for COVID Thursday, was buried outside his home by his sons. The panchayat had told the family to cremate him in the compound of their house, but villagers objected. When no help came from authorities, his 2 sons wore PPEs left at their doorstep by health department and buried him. Shanaton's 8-year-old grandson filmed it all.
বাঁচলাম তো সেখানে যখন আমরা পড়াবো বললাম তো পাড়া প্রতিবেশী সবাই আমাদের কমপ্লেন করে দিল। সেই জায়গায় আমাদের কেউ সাহায্য করতে আসেনি, বাধ্য মিলে আমরা 2 ভাই মিলে এইখানটায় গর্ত করে আমার বাবাকে ওইখানেই কি কষ্টে দাহ করেছি সে আমরা জানি, আমাদের কেউ আসেনি। আর আমরা যে 2 বাবাকে নিয়ে যে আমরা নাড়াঘাটা করেছি।
Kolkata reported its own horror story today. From Behala in the south, a 62-year-old died around midnight last night. The body was removed around 3 this afternoon after much public outcry. Monideepa Banerjee, NDTV.
So, every one of those stories really has a personal resonance with me. The last about the body being taken away more than 24 hours after the COVID patient had died, that was horrific, because I know that I lost a friend early on in the pandemic, very early on, and after he passed away, his family went into quarantine. Their house was barricaded with bamboo, all around, and if I wanted to go and give them some food and medicine, I'd have to drop it near the barricade, and they would come and pick it up later. And they finished that 14 days of quarantine that was mandated by the government at that time. But the police took huge objection when some members of the family stepped out, because I think some neighbors must have complained. So, the police came and put a policeman outside their gate, which was barricaded. So again, I mean, it was very early days, and there is an excuse. We really didn't know what was going on. But still, this blindness to facts, deafness to facts has remained. I think the most tragic thing about that story over there about the family that had to bury their dead father in their own house compound, I think the saddest element over there is about this Shonathan Mara gechen, the man who died. His grandson filmed the whole event. How dehumanizing is that? And then, of course, there is, the gentleman who lay outside a hospital ward next to an ambulance, and he died without any help. The ambulance driver stood there. Some of the dadas, I don't know if you could hear them, they were just, casually shouting advice to the wife and didn't come forward to help at all. And then the man died several hours later, by the way. The irony in that story, particularly the tragedy of that, is the man didn't even have COVID. And had he been taken to the other hospital in time, he may have survived and been with us today, but that was not to be. So bottom line is that this is what fake news has done to all of us in many, many ways. And that is, it has made us less human. It has dehumanized us. I'm sure all of you have, some or the other experience in this. So what is fake news? I've been looking for definitions, and there are lots. The most complicated but most comprehensive one was information that is likely to be perceived as news, which has been deliberately fabricated and disseminated with the intention to deceive others into believing falsehoods or doubting verifiable facts. So fake news is that. That's certainly a bit of a mouthful. There is another definition I came across, and that puts it very, very well indeed, and that all fake news is the reframing of a grain of truth. So there might be some little truth somewhere out there which has been reframed by the fake news makers and put to use to basically cause harm monetarily, physically, or to your reputation. This is, that grain of truth which the fake news makers will pick up, embellish, and distort to maximum effect. Sucharita, in your opening remarks, you mentioned misinformation and disinformation. There is a fine line over there that differentiate these two things. Misinformation when it is an inadvertent error based on wrong or incomplete information. But disinformation is the dangerous one. It's the deliberate spread of falsehoods to push an agenda, or one huge driving force behind it all is make money. So how widespread was it in India, or is it in India even today, particularly related to the pandemic? For several fact-checking sites have come up, and for them it is an ongoing study. But in the early days, Boom Live, which is one of the most active fact-checking groups, they put out some stats about March 2020, when the pandemic was just taking off. And they say that fake news about the pandemic started climbing in March of 2020. Before that, we were all involved with, the Delhi riots. We had the riots in Delhi, and there was plenty of fake news about that as well. Before that, there was the CAA, NRC movement, a huge amount of fake news about that as well. But suddenly in March, it is fake news about the COVID-19 situation that started spiking. The big spike came in early April, particularly after the Tablighi Jamaat incident in Delhi. I'm sure all of you know what it is, when a whole bunch of Muslim clerics met at Nizamuddin in Delhi and then dispersed, and suddenly there were these fake news a flood of fake news that appeared to claim that it is these people who were spreading the virus across the country. So what Boom Live found is that they did 178 fact checks on their website since COVID-19 began. And they found the most 35% were fake videos, 29% were images, 29% fake news was doctored messages, and the range of issues that they addressed was diagnosis, treatment, false quotes by celebrities, false notifications, lockdown guides. And if you recall, there was even an incident when there was a word that we in India, the country would be going under martial law. And it was so strong, this fake news, that the army had to step out, as it usually doesn't normally speak on these matters, but the army had to step out to dispel that fake news and said there was no question and no movement in that regard. Now, these were, of course, the various areas where fake news was getting dispersed, but one of the worst was, that after the Tablighi incident, a substantial portion of fake news was directed at a particular community, depicting them as carriers of the virus and complicating the collective fight against the rapidly spreading global pandemic. Even today, the video of a Muslim fruit seller seemingly licking the fruit, which was passed off as an attempt by that gentleman to spread the virus, that is still available on the net. I was quite shocked to see. However, thankfully, another worse video in which there was this horrific, which sort of reported this horrific fake news about, members of a particular community licking utensils. This happened out of Tamil Nadu, I believe. There was a clip going around where people were seen licking the utensils, and the fake news spread was, oh, these people are licking the utensils so that they can spread the virus. As shocking as that. Fact checkers, however, completely demolished it and said this licking of utensils was apparently a practice of a small sect of Muslim practitioners who apparently did this, certainly not to spread the virus, but actually symbolically eat every grain of rice or cereal or food that they had on their plate so that there was no waste. So this was apparently, a video that did go around. I have seen it in the past, but when I looked for it lately, in the last 2 days, I'm very happy to say that it has been taken off. So thank goodness for small mercies. The Muslims were not the only community to have been targeted. In Delhi, in Kolkata, certainly, there were many incidents of people from the Northeast being harassed, targeted, forced to leave their rented apartments simply because they looked, in inverted commas, Chinese, who were accused of spreading the virus. It was horrible, the kind of harassment they had to face day after day. Such was the spread that even the World Health Organization and the UN and organizations like that, they said that besides the pandemic, we are also victims of an infodemic. And it was as if, the movers and shakers of the fake news world were waiting for the pandemic to erupt. And the moment it took hold, they were at it with a vengeance. An infodemic that was as dangerous as the virus. In fact, I know that Mr. Tedros, he put it very well and said that the infodemic was spreading, or fake news was spreading faster than the COVID virus, it would seem. Okay. If it's any consolation, we in India were not alone. It was there across the world. Everywhere, there was fake news. And, the worst consequences that we have seen, of course, in recent months has been vaccine hesitancy. According to a survey in Europe, 10% of the interviewed population of Germany and France declared that they will not accept a COVID-19 vaccine. France apparently has the highest range of people who are unsure about taking a vaccine, just 28%. Anti-vaccine rallies have been popular in countries like US and certain regions of Europe. We know that a huge number of people, I'm sorry, I've missed out the percentage, but a huge number of people in the US haven't taken the vaccine. And maybe it's not because of fake news, maybe it is because they believe differently, which is fine. But in many cases, it is fake news that has driven people not to take the vaccine. You heard about Gautam Padhi, who had said that Covaxin has cow blood in it. And finally, of course, we saw what happened in Canada, where truck drivers who were protesting the mandatory vaccination forced President Trudeau to take the rare step of declaring a national public order emergency to handle this huge movement that paralyzed that entire country. They were all truckers who didn't want to take a vaccine, and so determined were they not to do so, they paralyzed an entire country. And even Australia, that island continent, was not spared. Social media was spreading the false claim that a particular vaccine, Pfizer to be exact, according to reports, apparently that vaccine could integrate with the people's DNA to transform them into genetically modified human beings. And therefore, loads of people, even in Australia, were suddenly found not to be taking the vaccine, not willing. So that is another problem that Australia too had to deal with. And how fake news traveled faster, as Mr. Tedros had said, than the virus itself. If you look at the next video, you will, and Shucharita, you don't have to play it in full. It is the Mexican video for your reference. So apparently there's a video going around in which you can see a health worker, a woman, giving a shot to a man, apparently of the COVID vaccine, but the video or the fake news claimed that the syringe was empty and that people were giving empty injections or empty vaccines to people and creating a black market in vaccines. And this was a Mexico video, which apparently was happening in India. Shucharita, would you play about 30, 40 seconds of that? It just goes on.
All right, ma'am. Just a second.
Long-lasting shine. Urban Company Professional Cleaning Service.
Sorry about that.
En relación a una denuncia publicada en redes sociales donde una joven refirió que en la sede de vacunación de la Escuela Nacional de Ciencias Biológicas, Unidad Zacatenco del Instituto Politécnico Nacional, en la alcaldía Gustavo Amadero, una enfermera engañó a su tío haciéndolo creer que le aplicó la vacuna Sputnik V contra COVID-19. El Instituto Mexicano del Seguro Social reconoció el error y pidió una disculpa. Asimismo, expuso que se procedió a aplicar la vacuna de manera correcta, sin mayores complicaciones en presencia de su familia, que a su vez atestiguó el procedimiento e informó en redes sociales.
That's about enough, honestly. But what is so dangerous about, the Indian situation is that, little videos like this can have a huge impact. And in India, we haven't really seen an explosion of, vaccine hesitancy, but given our population, even if a small percentage, reacts to videos like this and doesn't take a shot, it's a huge number. Even if it's 2% in India, it can be a world-shaking, event. Now, we have some 346 million users of social media, and something like this gets on there. And can you imagine the impact? Most of those 346 million users, by the way, are unlettered, barely educated, full access to Facebook, WhatsApp, Insta, YouTube, and so on, even TikTok. In the past, no filters. And they bump into a video like that, the impact can be devastating. As I said a little earlier, across the world, there is resistance to vaccines. In India too, there have been episodes. Some alleged celebrities have apparently not taken the vaccine, and that is something that is not being looked upon well, because celebrities have these huge followings and they just influence a lot of people. So that has been a danger in India. But I think you will all agree that vaccine hesitancy is not an explosion in India, honestly, and probably because there is a culture in India of taking vaccines. The polio vaccine is something that happens every year, and other vaccines. So perhaps the culture has saved us. And yet we have these amazingly funny situations evolve. There are two videos that follow. The first one is in Uttar Pradesh. And if Shucharita, you could play that, a man who climbs a tree to avoid people, the health workers who have come to vaccinate. And the second one, I need not say anything about. It's from Bihar, and it's really, really complex.
लगाओ जी इनको इंजेक्शन लगाओ
वही लगाओ चढ़ा के लगाओ उतारो
नीचे उतरो यही खड़े रहो खोलिए इसको आओ तारो लगाओ आओ तारो लगाओ आओ तू चढ़े तू
सरल लगी नु
आओ है पर चढ़ा तो नहीं है
यही पर चढ़ेगा अरे है जो
लाओ इधर चलो आप नीचे उतरिए पहले आइए क्यों चढ़ गए ऊपर
And the other one from Bihar.
Should we play the next video?
Yes, please. Yes,
yeah.
please.
Okay.
Yes.
Okay.
That's a really funny one from Bihar.
अभी आपको लगवाना पड़ेगा।
हम नहीं लगाएंगे,
नहीं लेंगे, नहीं
ठीक है भाई, हम नहीं लेंगे, हम नहीं लेंगे, चलिए लगवाना है सब लोग, हम नहीं लेंगे। अरे हम कहते हैं हम नहीं लेंगे, हम नहीं लेंगे। अब हम नहीं खाओ तो आपको भी पानी में फेंक देंगे अभी। ठीक है, हम नहीं लेंगे, नहीं लेंगे, नहीं लेंगे। हमको नहीं लेंगे, हमको तबीयत अच्छा नहीं है, और कौन रहेगा? नहीं नहीं, ठीक है भाई, हम नहीं लेंगे, हम नहीं लेंगे, हम नहीं लेंगे, अरे हम कहते हैं हम नहीं लेंगे।
There you have it, the kind of, it's again, you will admit, it's a bit comical sitting and watching this kind of video, but it can be dangerous. And I know that Reuters Institute was doing a study of the Ebola epidemic in Africa. And over there, a health worker was actually murdered for trying to ensure that people took the shots, had the medicines. So a laughing matter, videos like this perhaps, but this whole business of fake news really, really hitting where it hurts, affecting people's lives in the long term. Not just Ebola, the epidemic in Africa, but also in our own daily lives, we see polio, till the end, really caused an issue. And I know that the last polio victim in the country was a little girl from Howrah. And right now, that girl and her father are champions for polio vaccination, but that poor child ended up with polio because the family believed fake news that is there, out there even today, that vaccines, and this I'm talking about vaccines for polio, Ebola, certainly COVID, causes infertility, sterilization, and so on. And that kind of fake news is just refusing to go away. So what can we do? What can journalists do? We are virtually in a way, inadvertently sometimes unknowingly, we are spreading this disinformation. And we have a huge responsibility not to do so. So what do we do? Fact check, fact check, fact check. And, that is the only way to go forward for us journalists. Like, for instance, when this video of the Bonga hospital patient came to me, I couldn't believe what I was seeing, So I actually contacted somebody in Bonga to go and check out what was happening at the hospital. And after I heard about the incident, so that at least, so I couldn't go to Bonga, somebody else, a stringer, went and actually saw this drama unfold. So that is something we need to do at every step. Thankfully, there are fact checkers in place today in the country who are doing a great job, actually. They have shown us the way. There is Pratik Sinha of Alt News. He's been around since 2017, I believe. And he is registered with the International Fact-Checking Network, which is this global body of fact checkers. Then there is Boom, one of India's first and leading fact-checking websites. Boom also registered and partnered with IFCN. And there was, it was also a partner with Facebook on its third-party fact-checking program from India. What is so fascinating to me that the vehicles on which fake news circulates, they say they are trying to manage it. They are trying to tackle it. I believe WhatsApp has a helpline where you can send a fake video or a fake photo, and they will check it for you immediately and get back to you. Apparently, this WhatsApp helpline receives thousands of queries every day. Not all of them are serious, but some certainly are. It just does seem ironic that the very platforms used to spread fake news are also trying to do their bit to solve the problem. But as I mentioned earlier, there is a question mark over here, and that is, those clicks on fake news. That's what's earning them a lot of money as well. So there is certainly a conflict of interest, but the way things are spreading, the way fake news is spreading in not just India, but across the world, I think even these platforms, social media platforms, have had to sit up and take notice. I am not particularly tech savvy, but I can't say that I have used a lot of technology available out there to fact check, but I know of Google Lens and some other apps where you can actually go and check images or check video even, and they will sort of reverse image search and tell you the origin of the video, and that, as all of you must know, can help you get to the bottom of where this video has come from. What is good now, what is great actually, is that many independent bodies are setting up their own fact-checking teams, even media houses. I know Times of India, the Hindustan Times as well as India Today, the group, they are setting up internal fact-checking teams, which again does seem strange because media houses are only supposed to, disperse facts. But today, given the way things are, they are finding the need to fact check on their own. What is interesting is, there is the fact-checking sites, internal fact-checking sites are working. And the best part of it is that media houses are now having to take the onus of videos that they put out. Earlier, I know even on NDTV or other channels, we have seen, questionable videos playing out. And at the end of its play out, the anchor will say, XYZ channel has not verified this particular video. So, in a way, it's a way of shrugging off responsibility in case it is indeed fake video. So that's how, these fake videos allegedly would be played out on television news channels in India. But that is changing. Media houses are putting in their own systems in place to check news. So that's a good move. Again, I'll just quickly give you some figures from Boom Live. And Sucharita, I hope I'm not going completely over time. Boom Live in 2021 analyzed 794 stories and found 27 of those fact checks were on false reporting by Indian news channels and agencies and news websites, in almost all of 2021. So even news media organizations really have to stand up and take note and see how they can avoid falling into the trap. Some of the stories are their own, originated by the particular media house. Some are blamed on agencies, but there were that many stories that were fake and that ran on perfectly respectable media houses in India. Now, I was also sort of trying to study what is the solution that might work. So fact-checking is fine, but Reuters Institute in the UK and many other experts have actually come up with one solution that seems real and possible to execute to fight this problem. And that is fight fire with fire. Flood social media with accurate information. It could be the best way to counter disinformation. And the best part is you and I as journalists can do this job simply. Definitely, I would say get on social media platforms and put out the facts to counter the fake. And that is really perhaps the only way forward. Thank you.
Thank you so much, ma'am. It was indeed very, very detailed, and you did touch upon various aspects that are related to this pandemic or infodemic, either way. Am I audible now?
Better. Yes.
Yeah. So thank you so much. It was really detailed out, and you did touch upon various aspects of pandemic as well as infodemic. So thank you so much, and I'm very sure that our participants do have questions for you. So before we take them up, we can request Mr. Shomi Ghosh of US Consulate to kindly come in, and we can start the interactive session with our participants.
Hi, thank you. So thank you, Sucharita and Monidipati. Thank you so much for sparing the time, and thank you for joining us today. Our director Adrian Pratt could not join this program because he's traveling and he's not back to the office yet. But I take this opportunity to also welcome all our participants here. We have participants from our regional neighboring countries. So, Monidipati, if you think it will be helpful for you to also hear the perspectives from the participants from our neighboring countries like Bangladesh, Sri Lanka, and Nepal, that what are the conditions there in those countries? What are the conditions in terms of the fake news and COVID or the health sector, and what they are doing to counter the fake news? That I think will be good. I just want to say a few lines on why the US consulate in Kolkata or the US government is interested in this topic and why they're supporting these projects. Just to mention that if you all have followed President Biden and his work, you have seen that in December last year, the US Department of State hosted the Summit for Democracy, and one of the sessions under the Summit for Democracy was dedicated to media freedom and sustainability. This panel actually highlighted the importance of media safety, freedom, and sustainability in the health and the vitality of democratic process. Panelists discussed how the international community can do more to protect journalists, as well as how to reduce the vulnerability of independent media to closure or economic and political capture. So the US government is really dedicated to one, checking for news online, whether through Google, Twitter, Facebook, major newspapers, or media websites, and also through journalist individual approaches, as Monidipati mentioned about the fact checking. The US government also thinks that the countering and combating misinformation of all forms will actually lead to a stable Indo-Pacific region where journalists can do a better work, and the media can really cater to the public and stop the promotion of fake news through various social media and other platforms. So before I move forward with any other aspect of this session, I would really request our participants from Bangladesh, Nepal, and Sri Lanka in alphabetical order, I'm saying. So I'll request someone from Bangladesh to go first and talk about what is happening in Bangladesh. And you can use any language you prefer. You can speak in Bengali, we can translate that. And if you prefer to speak in English, that is also fine. So someone from Bangladesh? Yes, Ms. Nazneen, you can unmute yourself and then please share your perspective on fake news and COVID.
Thank you so much to give me the opportunities to talk with you and everything. In the pandemic situation in Bangladesh, when we face this problem, that time our peoples are too much worried about this new virus. When we introduced that time, our people also shocked. How can we manage that time, the situation? But our government's rules and regulations and their instruction, many of people followed. Right, and that is why our countries face this problem properly, and it's natural. Some of people are disturbed and they do they did some problematic some initiative, but this is very lightly, and this is very not effective for whole the peoples. But in India, it's too much viral. They use many types of product. It's also related to religious, and that is why this is the very impact on the country's people. So it's a really very good for the media's purposes, because media people are very effective for the people. What news we can use effective for us and peoples, and that is why it's the media's responsibility which news we publish and which news we declare, right? So in our countries, I am the international editor of the national newspaper. So I got many news from many agencies, international agencies, about India's situations and India's people's mental mental problems. They use religious products, and they it's really viral. So we also publish this news with the think about their people's mentality. So I think it's also the responsibilities of the India's media people or journalists to focus main concept of this reason why people use these types of product to survive in COVID-19. So this is the fact, right? So I want to say Indian journalists need to describe why they use this product to sorry,
maybe cure
from the COVID-19.
Ms. Nazin, I get you what you were saying. I think it's not just the Indian journalist. I think all journalists need to be careful, and they have to fight the propagation of fake news in all the countries. So thank you for sharing your perspective. Let me request someone from Nepal to share their perspective.
Yeah, we have Pavan. We have Pavan Mathema.
Yeah, Pavan, if you please
come in.
Hi, can you hear me all right?
Yes, we can.
First of all, thank you so much, Ms. Banerjee, for such an insightful talk, and especially the almost rather humorous videos that you shared. I think in Nepal as well, it was similar, but not to the same degree as in India. And because we're a lot more flows into here, we started off the talk with some of these hoax remedies that was very popular in India, and that was the same case in Nepal as well. I think during the first wave, when we didn't have so many cases, it was more of oh, nothing will happen to Nepali people because our immunity is so strong. So that kind of was flowing around on social media. But later on, it was more, as you said, the more dangerous, like what can be used as cures. I mean, in the last wave, we saw a lot of goat shops running out of meat because everybody was saying, oh, goat leg soup is curing COVID. So even these things that are not harmful, are they spread like wildfire. And I think it's the difference now is also how they are spread. We talk about social media, but it's also how easy they are to consume and share. That make it very dangerous. Like I saw several videos on TikTok, where it's so easy, right? When you're watching someone just flipping over and to share that, it's very easy to consume for an audience. So I think that also, makes fake news a lot more dangerous. Fortunately, in Nepal, there wasn't a lot about, discouraging people from taking the vaccines. So that was quite positive for us. There was, generally there was not an aversion to vaccines when it came to COVID. Yeah, I think I'd like to end at that and just thank you for sharing.
Thank you very much, Pavan. Monidipati, would you like to comment now, or would you like to hear from all?
I'd love to hear Sri Lanka as well.
Yeah, we have Ms. Niranjani Roland from Sri Lanka. Niranjani, if you may come in.
Yeah, sure. Thank you, Modidipa. You have shared many things which is happening in Sri Lanka also, right? You are correctly said, the WHO head said that not fear to this, but for the infodemic. So Sri Lanka also in the COVID situation, this disinformation, misinformation, that I on my the disinformation, misinformation gave the affect all the community itself, right? I can share some the post which is made the panic of the Sri Lankan people, right? The one the post as about this Ayurvedic in the indigenous medicine, right? The one vegetable soup can cure, increase your immunity, so you can within 3 days this COVID you can cure from the COVID, right? So people try for that. So that's the one incident, right? Another incident, another this thing I can share that one the burial, the graveyard, the one photo shared in the spread to the social media. This is a large graveyard in Sri Lanka, but that is in Indonesia, right? So this make people to panic, and that was in the eastern part of the Sri Lanka, which is many Muslims are there. So it's gonna panic them, and you know that there are some anti-Muslim a campaign also every day in Sri Lanka, but within this COVID situation, there was something happened, right? Because you know, they are the burial, the Sri Lanka government make everyone to criminate these bodies, right? So that also made much affect to the people. And another thing, there's another this thing I can share. The Sri Lanka had the first global COVID-19 there's which is showing the research from the American John Hopkins University data. It also false, right? The people get panic because of all this disinformation and misinformation. People, even they are get these symptoms of the COVID, they don't willing to come and check, right, to the hospitals. So because of that, you can see that many COVID patients, the police has went to harass like accused. They catch these people like accused with all the guard and all. So this all made the people the stigma, and then the stigma and discrimination also happen in those days, right? The migrant workers as COVID spread, right? Those who infected the first cases in the migrant workers. So the people label them, and then the Muslim COVID, so they are the super spreaders. That also happened. They are against the Muslim. And there's some government workers, the government women's in the government sector, they got affected. Finally, every government sector, the women's, they got labeled. So because of that, they not willing to come and check and all. This all happened to this COVID misinformation. Another thing, another example I can say that the rapid antigen kit produced in Sri Lanka for the cheap price, right? That also one this thing post through the Facebook and all. Finally, when the journalists do this key search through the Google image, and they found that is manufactured from the Swiss pharmaceutical company. So when they asked that company, they said there's no manufacturing site in Sri Lanka. So another one thing I saw during that pandemic season, many fact checkers, institutions, the journalists alone, they become the good fact checkers. Many institutions gave the training for them. One side one side the misleading information or spreading. Another side some medical officers and some media organization gave the awareness and training to the journalists. The media literacy also they did. So because of that, we can somewhat curtail it, but the misinformation and everything still there. So as a journalist, what my practice and all, first I saw something, I see whether that is when the post, the date I'm checking. So sources who's put in this. So the image I'm searching through the Google image, or if there's a video I use in the invite. So that is how now we are some journalists, they are doing this fact checking. So I think that during this pandemics, that also now many people successfully doing this fact checking also. Thank you for this opportunity.
Okay, thank you.
Thank you so much. Sorry, I was cut off for a while, but Monidipati, would you like to comment first, and then we can move to someone from Northeast and maybe someone from other parts of India. And
Let's go to the Northeast. Honestly, this should be an interactive discussion because their experiences are huge. Sri Lanka, Nepal,
Yes.
and Bangladesh were fascinating.
Right. So, okay, let me request someone from Northeast or someone who also, covers Northeast like Manogia or Sahana. So anyone from Northeast? I think Ms. Durba Ghosh is also from Northeast. So anyone from Northeast or who covers Northeast?
Hello.
Yes, please.
Okay. I cannot start my video. Hello. Hi. Can you hear me?
Yes.
Yes, you're audible.
Okay.
Yeah, your video is also on.
Yeah, this is Joyashree from Manipur, northeast of India. Here, the vaccination rate is still very low. As of yesterday, the vaccination rate was 27 lakh something. That is including first and second dose plus the precautionary dose. So only around 15 lakhs people have received the first dose. And especially in the hilly region, in the remote places, the vaccination rate is very low. This is understandable because of the road condition, as well as misinformation about the vaccine. Over here, what is happening is there are rumors spreading around that the vaccine is the anti-religion. Like example, for Christian, they say that if you take the vaccine, it's like getting yourself marked with Antichrist 6 strain. So many of the hilly regions, hilly population, they are Christians, so they are reluctant to take the vaccine. But slowly now the vaccination rate has increased because efforts have been made by the local MLAs and NGOs and other civil society organizations to clear away the myth regarding the vaccine. So myth is the misinformation about the vaccine is definitely hampering the vaccination rate in my state. And today, I would like to say that this discussion, this webinar is grateful even for me as a journalist, because there are other things that there are so many things that I learned from ma'am. She gave a very in-depth detail with videos and everything. So I'm grateful to be a part of this discussion. Thank you.
Thanks, Jayashree. Maybe Manugia, would you like to come in?
Yes.
Well, yes, thank you, Monidi. I feel blessed that I've worked with her and in field, and I look up to her for her voiceovers. Monideepa Banerjee, NDTV. There's nothing as smooth as this.
Thank you.
So in Kolkata, Monideepa Banerjee, NDTV. Was I right, Didi?
Manogia, please carry on. Yes.
Okay. So with all the points, I almost agree with Didi, and but we need to understand 2-3 things. What you're searching is searching you, and that's precisely internet is all about. So if you search for 3 videos that are anti-Muslim, you will be flooded with 50 videos that are anti-Muslim. If you search for 3 videos where Hindus have hurted Muslims, you will be flooded with similar videos, and that's how the game goes on. They means the search engines of internet know you extremely well. They know you more than you know them. And that's how the video and the content goes viral. So it's also depends on the number of users which that particular brigade has. That's what India and worldwide everyone is facing. Even media is divided at the international level when you talk about Russia and Ukraine. So if you have been searching and reading a certain type of content, you will get videos showing that the Western world media is trying to portray dead bodies of or from Ukraine, which are not dead bodies. Now, that was a fake video doing the rounds, a video from another part of Europe being shared as something from Ukraine and then being shared widely across India as well as worldwide. So it is not a menace that only we at local levels are dealing with, but the international and global platforms are dealing with it too. During the elections, Twitter made it very clear that certain videos that would be posted with content related to politics will not be seen with the number of actual views, instead with the number of views that the Twitter decides to share it with. So if my video touches 1 million, has a political content in it, might not show as 1 million views, instead will be somewhere in 50K or 100K, or even the rate of growth of that video wouldn't be the same. We as fact checkers, we were also talking about what is the need for media houses to be a part of the fact checking team. Well, that's a part of the international treaty that is there for fact checking internationally, that also gives a lot of authenticity to the media houses. While I've been working with India Today, we had a pact with Facebook to fact check for them continuously, regularly. That wasn't an easy task, because anything uploaded by anyone across the country has to be fact checked based on what is shared on the platforms only. Or even if you reach out to them, these are anonymously uploaded videos which do not have any authenticity. And trust me, media is history now. Social media is what is present and future. You talk about newspapers, you talk about the digital platforms. Even the biggest digital platform is being challenged by any Tom, Dick, and Harry on the social platform. That's not a very good thing. For someone who's given 4 decades of his or her life to the profession, being questioned for what you've done is done only for journalists, I believe, not for any other profession. And also precisely the division amongst the in the fraternity itself has been a reason to create so much of crevices and to be used by vested interest at regular intervals. You talk about Ukraine versus Russia, you talk about India, you talk about Manipur, or you talk about our West Bengal itself.
Thanks, Managya. I think Durba Ghosh, ma'am, has some other commitment. She is leaving now. Ma'am, would you like to say a few words before you leave? Maybe share your experience or any point that you would like to mention.
Sucharita, I think she has already left.
Okay. Okay. So we have with us Debjani Chakraborty. Something?
Am I audible?
Yes, you are.
Hello.
Yes,
Yeah.
you
Am I
are.
audible? Yeah. Sorry, I started traveling. So yeah, hi to everyone, the speaker here, Monalita ma'am, and I am Debjani, and I am based in Jharkhand. I have been active as a freelance journalist from Jharkhand, and currently I'm also pursuing my PhD in media studies from the Central University of Punjab. So yes, I am a little bit into academics now. So the idea is the entire session on misinformation and disinformation and the idea of fake news. Theoretically, in academics in the last year, I have also come across the technical studies around how misinformation and disinformation is spreading, not only across India, but across international borders. And the idea is to actually educate the people about their understanding of what is intended form of fake news and what is unintended or misinterpreted form of. The entire session was very informative, and as media persons, I believe the right way to go about busting of fake news is to educate people to identify what is fake news. Specifically in newsrooms of smaller cities, since I worked in Ranchi, and even in smaller bureaus like Dhanbad, which is even much smaller in Jharkhand. So what happens is the news in the newsroom, people are not that technologically sound. People are not very okay with using mobile phones for sharing information. They'll take a call, they'll read a press release and write about it. If they see a video, they'll believe it. Even journalists, they believe whatever is around them. So our next step should be, as a fraternity, is to reach out to the smaller bureaus and reach out to people who are not very technologically sound to identify the news sources and teach them to fact check. Because fact checking at a higher level is happening. We have had capacity building at the higher level in Delhi, Bombay, Kolkata. That is happening. But in smaller places, I am right now based in Bhatanda. I just moved, and even in Bhatanda, in the smaller towns, what happens is the journalists are not that well equipped. And I believe, yeah, we should be focusing on newsrooms which are smaller, on journalists who are independent, who are not that technologically sound, and educate them in the future. The information shared today was very informative, specifically something very simple as Google Lens for reverse searching the source of an image, right? So that is something that has been extensively researched upon, even in academic journals. I was One of my colleagues did a paper. She was actually researching fake news, and her work was on all the studies that have been done on the issue of fake news across the world. And she came to an interesting conclusion in her study, is that we assume that most of the fake news is circulated through WhatsApp. But interestingly, in her study that studied all the papers that are available since the COVID pandemic happened, Facebook was actually the source of fake news because people tend to believe Facebook more. So I believe these are the kind of insights from academia that we need to take back into the industry and actually do some sort of knowledge sharing with the academy and industry so that we have better outputs in the future and actually combat the problem more easily. Thank you, ma'am. Thank you. Lovely connecting with all of you. And
Thank you, Devjani. Thanks a lot for sharing your insight and your experience. We also have with us Ms. Kamaljit Sandhu. Ma'am, would you like to come in and share your experience or any feedback?
I'm not too sure whether you're getting my video. Let me just start there.
Yes.
So hi, I'm actually joining from Punjab. This is where I'm covering elections. But you know, this fake news and disinformation is something that the journalists have been facing, for quite some time. There is also something like a WhatsApp journalism. There's also several fact checks. The government has its own fact check. But a lot of times they don't really move in time to dispel the myths. One of them was because of the vaccine hesitancy, including the other one in Punjab. A lot of people believe if they take vaccine, they'll be infertile or there would be some problem with the sexual function or whatever. So all these kind of things. And when you are actually putting it out, we are trying to talk to people who are using social media, who are consuming a lot of it, and people who are generally aware. In villages where we were going and speaking to people, this was something like this is government created. There is nothing called corona. And even today, the level of people who are taking vaccines continue to be only amongst those educated. Like the government had put a norm, especially in Punjab, that if you want your salaries, you need to kind of get vaccinated. So I think there are several obstacles that each one of us face. We are looking at traditional and not so traditional media where we are addressing certain issues. But clearly, when it comes to that, when in Delhi we were reporting the Tablighi Jamaat and how it was blamed, this is also part of disinformation campaign, and we need to work progressively against that, to ensure how to spread that message across. Not to blame one particular community. And we saw earlier than when elections were happening or otherwise, there have been large congregations. And even when we step out now, most people have dispelled with the notion of wearing a mask, whether it is in Delhi or in other places. Maybe cities have much more of that. So again, when you're talking about information, even within the family, there are a lot of times where we all sitting and discussing, and people will say, oh, this came on WhatsApp. So people generally tend to believe that much more than going into a fact check site. We are journalists, and we kind of consume news a certain way, and we look up to each other. We know how to go about it. But for the common person or common man or a woman, they may be relying on their mobile, and that itself is an issue. Now we also know, even when it is talking about politics, when we're talking about, as Manoge was talking about, Ukraine and Russia, so whosoever side you want to take, you will kind of believe the information coming in from that particular thing. So to have that sort of a thing, and to take it forward is a big challenge now. Even in India, if there is a political party which will put out a certain information which may be actually a disinformation or a fake news, and the other party doing this, so sometimes if there is a perception which is going against, they will unleash so many videos and unleash so many ideas that you will not know which one is real and which one is fake information, leaving a person much more confused. So I think it is also about, one, creating that kind of a network where we have a reliable system of fact check, but also to ensure that there is, and since this is multiplicity of function in terms of internet, you cannot stop somebody saying you cannot access this. Like now we know that the Russian TV or the RT has been blocked, but mostly in a free world, you have so many platforms, and one has to go through a whole lot of checks. But again, to reach to a common person and to ensure that person is getting right information remains a challenge.
True that. Thank you so much, ma'am. It's actually lovely to get to know about different perspectives coming from different regions of India, and not only that, also from our neighbor countries. This, of course, gives us a very holistic understanding about the ground scenario. So thank you so much. Moving on, we also have Ms. Kritika Goel with us. Kritika, your inputs on the topic.
Hi, thank you. I'm sorry about my video. My internet's a little unstable, so I won't be able to switch that on. But I think this session was really, really informative. I work as a fact checker with the Queen's fact checking unit, WebProof. And during the pandemic, we've seen all of these narratives which were spoken about even today, as we're talking about Russia and Ukraine. All these narratives that have been discussed so far, we've seen these debunked, these one thing that I just want to add, that somebody pointed out, that misinformation or disinformation, that's not always circulated through WhatsApp. There's a lot of it on other platforms like Facebook and Twitter. I just want to add to it, saying that a lot of misinformation, at least during COVID, we saw that it was also circulating through word of mouth. So we're working with certain partners in rural areas of Uttar Pradesh, Madhya Pradesh, Assam, and Bihar. And we actually found that things that we were seeing on WhatsApp was also something which was spreading within the community through word of mouth. So if somebody in your area, one of your friends or somebody tells you that, don't take the vaccine because it's going to lead to infertility, or don't take the vaccine because you will die. So I don't know if everybody would remember, but there was a very, very viral piece of content which quoted a virologist saying that you will die within 2 years if you take the vaccine. And it was massively viral. But that's also something that jumped, that just didn't jump on WhatsApp groups, but that was also something which was circulated through word of mouth in these communities. So I think awareness is definitely, other than fact checking, debunking, and putting out these stories, telling people what the truth is, creating awareness and amplifying those fact checks so that people who are actually exposed to the misinformation have access to that misinformation. I think that's one major challenge that the community faces today, that fake news, misinformation, disinformation, that travels much faster as compared to fact-checked information. So it's extremely, extremely important to amplify those fact checks, to share those fact checks, to produce them in formats, in languages which are accessible to people who are actually vulnerable, who are actually exposed to this sort of misinformation. So yeah, I think that's the only tiny thing that I could add. Otherwise, the session was wonderful. And yeah, thank you so much Monadeepa ma'am, it was great to hear you.
Thank you.
Thanks, Kritika. Yeah, very true, very true. We cannot really deny the role of community in the physical space. Not always the disinformation or misinformation is circulated over, through social media platform. It also spread through word of mouth. Yes, very important point. Um, we have Miss Lima Sena Jamir with us. Lima Sena, would you like to comment on the discussions that we are having? Lima Sella, can you hear us? I think there must be some server issues at her end. So anyone else from our participants? I think we have been able to seek inputs or feedback from all the participants who are present. Unfortunately, a couple of them had to leave because they had other commitments. So Sarada Lahangir, ma'am, would you like to come in?
Yes. Yes, thank you so much, Monadeepa ji. I was a big fan of yours. You do not know me, but I know you very well because you are the close friend of my Didi, Ajita Didi. Yeah, it's a very insightful, talk, and I just add a couple of things from my end. Basically, you know that I, stays in Bhubaneswar. And Odisha is a state, disaster-prone state where every year or alternate year there is a cyclone, and during that time, we face a lot of, this kind of issues, information, misinformation, and fake news, and which really, really impact the common people as well as the journalists as a whole. I add something to the Devjani, like what she said, that it's the fact-checking thing and this, information about the awareness about the information and disinformation. The journalists from the big cities, and they are much more aware of that. But in the small cities like Odisha, where there is a at least 10 to 12 vernacular newsroom, both print and television, and where every minute there is a race of the breaking news. In this scenario, checking the doing the fact check, and whether it is information or it is a misinformation or disinformation, is very difficult or very tough task, because I have been a reporter for the field for last many years, and right now I am in the newsroom. I worked in the newsroom as an editor. It is very difficult, to because there is a huge pressure from the management side. This channel broke this news. Why don't you break this news and all that? And the disaster part of this, even if some news or some fake news just skipped, like we rely on some of the agency for the national news, because most of the television don't have the correspondent in the Delhi and the other part of the country. Like if something has happened in Punjab or in Kashmir, we really don't have, the Odisha channel don't have the correspondent there. So we basically rely on the news agency and looking up the other channels. So if some news came across and we telecast that, and later on you found that it is not the actual news, it is the fake news, or it is something the news which has been exaggerated or distorted. So that time there is absolutely no scope, or we in the channels, they don't want to clarify that news later on to make people aware of this. See, this was not the real news and this is the real news. We have made some mistakes and all that. unless and until some complaint laws against them that this is not the news, you have run the fake news. Because that time the channel actually they thought that this is this will impact their credibility because they have already shown that now that. So basically there is a fairness. And the second thing I would like to say that in Odisha news, newsroom, there is absolutely no team for the fact checking and all that, and it is very difficult for a one journalist who is on the field and giving throw and throw lives. I mean, how can he checks? I mean, what has happened or not? And I mean, Monidipadi clearly connect with me what I wanted to mention here, because it is absolutely not possible for a journalist to check every news. I mean, whether it is information or misinformation or disinformation. So that is the problem. So I think, I mean, that from the very beginning, I mean, the journalists, the budding journalists, they should be aware and they should be trained properly on about the fact checking and this kind of issues. The secondly, every newsroom should have their own fact checking team, so that at least, I mean, the news coming from the field, I mean, they should at least scan in the newsroom through the fact checking if there is some sensitive news came in. So they should do the fact checking. So that's all from my side, and thank you very much to everyone, and thank you Didi, namaste for your insightful comments.
Thank you so much. Thank you so much. Yeah, so we have been able to cover all our participants in this roundtable. So over to you, Shomikta and Monideepa Banerjee, for your final comments.
I think Monidipadi should comment and should share her insights, because she was leading the session, and it was really helpful, because when we are thinking that maybe COVID is gone for the time being, if we look at China, it's coming back. So I think the fake news and the misinformation are going to stay here for a while, as it is coming back. I hope that India will not be affected the way China is. So I think, Monidipadi, I'll request you to say the last words. And again, thank you everyone for joining today. We will continue with our misinformation and disinformation program, and we also plan to bring you all to the American Center in Kolkata later this year, when you can all interact in person and come up with a strategy how to counter disinformation. But I really like the idea that every newsroom should have its own fact-checking team. I think that's the great takeaway from this discussion. Over to you, Monidipadi.
Thank you. Sucharita, how many minutes do we have left? Sorry.
5.
Sorry?
Yeah.
We have a little time, because, if I may ask a couple of questions of all the participants, if they are still here. As you mentioned, Samik, that the biggest takeaway is that we have internal fact-checking mechanisms. I mean, gone are the days when you can blame an agency for giving you false news, or, somebody else. Gone are the days of saying that this media house has not verified independently this particular video. So given that, I'd love to know a little more from Kritika about how many people are there on your fact-checking team? What kind of tools do you use? That's a little gray area for me. And is there something you could share in real terms that would help each one of us in today's discussion on fact-checking for ourselves? Kritika, if you're still...
Yeah, I'm here, ma'am. So we're a team of 7 people, 2 in the Hindi team and 5 people in the English team. The tools that we use, other than the ones that I think all of us are aware of, reverse image search, Google, we use InVid, that's mostly used for video verification. That helps us to divide videos. Then there's Twitter advanced search, TweetDeck. They always come in handy when you're looking for something which is on Twitter, because a lot of times today, most of the information is on Twitter. Lots of things go viral on Twitter. Facebook, Google advanced search, that mostly helps when we're doing data studies, when we're looking for government data. Again, it narrows down our search, it filters the search result, and it helps us find out the right source for whatever we are looking. Then there are other tools like CrowdTangle that comes in handy when we're trying to track narratives on Facebook or Instagram to see what is the kind of information which is being circulated around a certain incident or a certain event. Then there are other tools like Social Blade. That's a social media analysis tool that we use. There's a tool called Trends Map that we use to track narratives on Twitter. So yeah, I mean, most of these tools, they come in handy. And other than that, honestly, we still get in touch with our reporters. We still get in touch with other reporters who are on the ground to get information from them. We try and get in touch with police officers, authorities, departments to get the right information. The only thing that we, I think, don't do is that we don't quote a source, because it's a fact check at the end of the day. So it's important to give evidence, it's important to give proof, and it's also important to have that person on record saying whatever information they are giving us. So I think avoiding sources is the only thing that we do when it comes to fact checking. But other than that, it's really a combination of reporting plus using digital tools to investigate and find out the truth behind anything that we're trying to debunk or fact check.
Thank you. I sometimes wonder if, because of our own diversity in this own country of religion and ethnicities, that perhaps we became easier praise to the kind of fact checking, to the kind of fake videos that we saw, go into the market during the pandemic. I'd love a quick word with the lady from Bangladesh, if she's still there. And I'd be really happy if she spoke in Bangla at the cost of some of you, perhaps. Ma'am, are you there? Is she there? No? No, she's not.
Can you hear us?
Nazneen, আপনি একটু বলুন কি আপনাদের দেশে who is doing fact checking? Does your newspaper have a fact checking team? আপনাদের ওখানটায় ফেক নিউজ কতখানি বেড়েছে? ওখানটায় কি কোনো ভ্যাকসিন নেওয়াতে কি কোনো অসুবিধা আছে? লোকজন কি বলছে তারা ভ্যাকসিন নেবে না কারণ এই হবে ওই হবে, এরকম কি আছে?
না, আমাদের এখানে সরি আমি বাংলায় কথা বলছি, সেটা হলো যে আমাদের এখানে কোনো সমস্যা নাই আপাতত। ওরকম কেউ ইয়া করে নাই যে আমি ভ্যাকসিন নিব না। মানে এখানে এরকম যে না ভ্যাকসিন নিব, আরো বেশি ইন্টারেস্টেড, দে আর টু মাচ ইন্টারেস্টেড টু টেক আ ভ্যাকসিন। অ্যান্ড মানে প্রত্যেকটা ডোজই তারা নেওয়ার জন্য ইন্টারেস্টেড। একটা ডোজ মানে তারা সবসময় ইনফর্মড হতে চায় যে কখন আমারটা আসবে, আর কি আমার টার্ম আসবে, যে আমার ভ্যাকসিনটা ফুলফিল হলো। তো এটার জন্য আমাদের বাংলাদেশের ম্যাক্সিমাম লোকই কিন্তু ভ্যাকসিন নিতে ইন্টারেস্টেড, এবং তারা এরকম না যে ভ্যাকসিন নিব না, এই ধরনের মন মানসিকতা খুবই কম। আর হচ্ছে যে বাংলাদেশের সবাই এই COVID-19 অ্যাকচুয়ালি আমাদের দেশের পিপল দে আর ওরিড অ্যাবাউট দেয়ার বিজনেস অ্যান্ড দেয়ার জব, যে তারা ঘরে বসে থেকে যে এইটা নিয়ে প্রিভেন্টের জন্য যে ঘরে বসে থেকে যে কিছু একটা করব না, বসে থাকবো, এরকম মন মানসিকতা খুবই কম। তারা ঘরে বসে কিছু করার একটা চেষ্টা করছে, এবং ওমেন এন্টারপ্রেনার অলসো আর ভেরি ইন্টারেস্টেড টু ডু সামথিং, হাউ ক্যান উই সার্ভাইভ ইন দেয়ার সিচুয়েশন, and they use this platform, মানে digital platform to earn money. So this is the plus point for our people, and COVID is hampered our life, but they fight properly with this situation, and economically they are supported with the platform, digital platform. So
I thank you so much. And if Kamal is there, Kamal from Punjab, I mean, I really didn't know that there was such a program going on in any state, that to get your salary at the end of the month, you need to be vaccinated. I haven't heard of this one. I mean, I've heard of two child policies, but vaccinate or go without pay is something that I've heard for the first time. Fascinating.
It was only meant to encourage the government employees from taking, because Punjab at one point of time was facing the lowest vaccination rates. So Haryana and Punjab put in measures where they were trying to encourage. So one of them was this particular tactics because hesitancy was at a great level. So, when we went there to the vaccination centers, a lot of them who had taken their first shot, made it, after several months, made it to take it to the second shot.
That's crazy. I haven't heard of this one anywhere else in the country. And see, lots to learn, really. And there was fascinating inputs from all of you, really. Thank you so much. Anukia, for bringing up Ukraine. I think all these huge, earth-shaking incidents have really become, sort of a spur for fake news, and it's, really unfortunate, shocking. But I think fake news is pretty much here to stay. So we had better start grappling with it. Joyশ্রী again, she has. Joyশ্রী, right? Usham from Manipur, she highlighted this other interesting point, which is, bears repeating, that because we are a country with such diversity, I think we are also easier victims of fake news. On the one hand, we had the Tablighi disaster, which was revealed us in very, very bad light as a country where minorities were targeted. That was the Muslims. But even out in Manipur, you have Christians who have reservations about taking the shot. I have to tell you, Joyশ্rী, if you're still there, that I was reading somewhere that the Pope in January this year has actually put out a statement saying that it is a duty of all Christians to take the vaccine. I hope that message reaches the hills of Manipur as well. We are really a challenge. We are facing very, very challenged times. And by we, I mean the media. I mean, how do we, check things for veracity? That's a huge challenge for us in the media. I'm happy to see in the last couple of days that I was researching this talk, that there are a lot of courses on offer across the world, actually, on, encouraging young journalists to go into these courses. They have scholarships, and I would really encourage all of you to look them up. Even Facebook and WhatsApp apparently have some scholarships that you can apply for, and several universities as well. Reuters Institute in the UK, I'm sure there are plenty in the US. I would encourage, education as be a way out of this mess that we are in, education of journalists. Remember, we are the messengers in a way. And the last thing you want to be is a messenger of fake news. So it is up to each one of us really to be on the ball and ready to take on this huge challenge that fake news has thrown at us. I mean, the phone, a wonderful, wonderful, instrument, so empowering. It has made me a different person. I'm sure it has changed all your lives, but my goodness, the kind of damage it can do is truly frightening. So as messengers, please have an extra responsibility. There's one thing that at this point I'd like to say, Manogya, you were saying that, the day of newspapers and television and journalists is over with social media journalism and journalism. I will beg to differ on that. I think we still have some relevance because we are journalists, we have some training, we have some awareness, we have the habit of questioning, we are skeptics. I think that is the only thing that will differentiate a journalist from a citizen activist or one of those people on Twitter who will question everything a journalist says. So I think journalists are going to remain very, very relevant in this fight against fake news. Only remember that you have to be on the ball, educate yourself, and don't put out fake news ever. The messenger with the right news. The only way to combat this, again, I say, is flood your personal handles with accurate news. Perhaps the best thing to do is fight fire with fire. Thank you so much. It was wonderful talking to all of you.
Thank you so much. I thank all our participants, US Consulate, and of course, Ms. Monideepa Banerjee for bringing to us such insightful deliberation on this very pertinent topic. So thank you so much. Before we conclude, I would like to give all of you an idea about what we plan to do next. our team has already identified a number of videos that have gone viral in the recent past. I would like to put it in a way like these are about the parallel theories about pandemic or vaccination or wearing masks. So we are trying to not really debunk, but kind of do the fact checking for these videos. So we have segregated part by part on, we are taking statements. We have identified major statements made different people or different groups in these videos, and we are trying to do fact checking on us by us. So we would certainly like to seek your advice, your feedback from all our participants on this activity. So very soon we will be sharing a draft structure and probably one example that what exactly we are doing with all of you. And if you have any feedback, any inputs, any advice on this exercise, please feel free to let us know. That will help us do it in a more holistic way, in a more relevant manner. So thank you so much. It was really nice having all of you on board today. Please keep in touch, and we will get back to you regarding the other program that we are doing, the series of webinar that we have been organizing. Yes,
Thank you.
Well, thank you so much for having us on board.
Yeah, thank you so much. Pavan, are you saying something?
Yeah, I was just saying thank you so much for everything.
Okay, thank you.